In order to heal from an injury, we need to avoid re-injuring ourselves. So I'd like you to take some time to come up with a list of all the activities that cause you pain and attempt to avoid these activities as much as possible. For those activities you still need to perform, I'm going to show you some modifications. We're going to go over the right way to correct your posture and a safer, healthier way to perform everyday tasks. First and foremost, you need to avoid excess sitting with your head forward and your back curled up in the fetal position. This is going to put excess compression forces on the front of your vertebral discs, which is going to push the disc backwards, leading to disc bulges and herniations. This is also going to lead to immobility of your hips and knees due to tightness in the muscles that cross the front of the hips and the back of the knees. And over time, as you go to stand, you'll notice you'll be unable to stand fully upright. And you'll have to walk with this gait pattern that is synonymous with aging. In order to avoid this and all the ailments that come along with it, I'd advise you to sit as little as possible. When you have to sit, attempt to sit up tall and bring your work to eye level. Keep your feet and knees spread apart, which will allow movement to occur through your hip joints as opposed to your spine. Alternatively, you could make use of a saddle chair, which will allow you to perch while you're sitting, keeping a more neutral spine. If you have to sit for an excess amount of time, try to make sitting a dynamic activity. Go ahead and pump your ankles. This is going to provide movement to your hips, knees, and ankles and perfuse those joints with blood. Every few minutes or so, go ahead and come to a stand and bring your arms behind your back. And then you can return to sitting. You could also make use of a standing desk. The proper way to stand is with a semi-military posture. This means having your chin tucked, shoulders back, chest out, hips forward, tight abdomen, and tight glutes. If this is too difficult to hold, you may purchase a posture corrector, which will help you maintain proper posture throughout the day. When retrieving an item from the floor, try to maintain a flat or neutral back. Move close to the item, place your hands on your thighs, and keep your chest out. Slide your hands down your thighs till you get to your knees, then grab the item, secure the item, and then thrust your hips forward. By thrusting your hips forward, this will bring you back to a full stand without causing you to lift with your back. If that's difficult on your knees, or if the object is lower to the ground, you could use a golfer's pickup. So you're going to bend at the hips, throwing one leg back behind you, grab the item, and hinge upwards. You could also perform a lunge with a flat back, grabbing the item, and returning to a full stand. But whatever you do, do not pick up by bending at your back, and especially do not twist with a flexed back. This is a surefire way to rupture a disc. Instead, use one of those other methods, return to a full stand, take a few steps, and place the object where you like. I ask that you take a few steps because if you plant your foot and twist on that leg, there's possibility of creating a meniscus tear. For further knee health, I'd advise you to avoid low chairs. When you have to sit, go slow, not low. Make sure that your knees do not go inward or out. Try to maintain a neutral alignment with your thighs, your shins, and in the direction of your toes. And if you notice in standing that your knees tend to be a little knock-kneed, then you might want to purchase a medial heel wedge, which is going to slightly turn your ankles outward, which may correct the alignment of your knees and help attenuate further issues down the road. As far as shoulder health, I would advise you to limit overhead motion and rotational motion at the shoulder especially those two motions combined. That is going to put excess stress and risk of injury on your rotator cuff muscles. Instead, I would keep activities to a shoulder level and below, bring work to a lower surface. When you do elevate your arms, keep your hands about a yardstick apart from each other and your thumbs pointed up. This is going to slightly externally rotate your shoulders and keep the movement in the scaption plane, which is going to decrease the amount of rubbing in the joint during movements. And you can remember this by thinking thumbs up to shoulder health. If that continues to cause pain, when you use the affected arm, make sure to bend the elbow, elevate at the shoulder, extend the elbow, grab the item, bring it back, then bring it down. That's going to decrease the amount of leverage that's put onto the rotator cuff muscles. As far as sleeping, remember that we spend about a third of our life in bed. So I would advise you to avoid a soft foam mattress. Instead, use more of a supportive mattress, and if you need to, you may purchase a mattress topper or use a towel roll to help support the natural curves of your body. Try to keep in mind that these are not just activities. These are all-day, everyday habits. This is going to help you heal, it's going to lead to less pain and a better, healthier you. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.